the admission letter reads. Then I reminded her that she knows that she should remember that I'm a very tough supervisor and that I will read your work at least 10 times before I can sign you up. And she said she knows, she remembers. So you are in for another round of that experience. Now, of all the students I ever supervised, Dr. Badari gave me no troubles at all. In fact, I have to look for words to correct in our work. So I have to leave technicalities now for grammar because the technicalities were superb. She was appointed a consultant family physician with UCH, and I thought that will distract her concentration on the masters. But it did not. When we agreed on an appointment, she be punctual. And since I became dean, a lot of those appointments, I will be shifting them at the last minute. She was patient. She would say she will wait until I leave a meeting, or that she will come back. Her attitude to her work is exemplary. The quality of her work is excellent. It was so excellent that when she finished that master's program, I know that she will proceed to a PhD, and I want to see the opportunity to supervise her, because you couldn't have a better student as a lecturer. I compared her to register for a PhD. I know that they do MD in the National Postgraduate Medical College. I want to seize that opportunity to be the one supervisor. That is the extent to which our quality was. To cap that one also, the work was so good that I asked her to expand it for submission to the grant of the Royal Society of Tropical Medicine and Hygiene. And I want to tell you that as recent as May 13, we were still corresponding on that submission. When she told me, this is at 9:22 a.m., she sent a text that she has already submitted it. It is inconceivable to me that somebody through that much pain, that much illness, will still be up and doing concerning her work. She never betrayed that she was going through anything so serious. In fact, I started asking myself, because I pride myself among lecturers as perhaps the closest to students, try to get to know them. I never knew this aspect. That is the depth of her strength, the depth of her character. It is only a faith on a supreme being, in a supreme being, that transcends every earthly pain and sorrow that could have made her to stand up that strong. She demonstrated that she believed in somebody that is able to carry on beyond every phase of life. And that makes me to conclude by saying here that we often think that what we do where we are on earth is what we'll be remembered by. We actually may not be remembered, except we are really very bad, or our works became something concrete for so many people to look at after. What is most important is your enduring faith in your Creator and the one that is able to sustain you, whether in the present or out of the body. Dr. Olusola Obadare will be very much missed, because there were great works that were unfinished and which can no longer be finished because of her transition. She'll be missed by the students who reported to me that she was very generous to them. individually, meeting their needs, while she also has needs. She'll be missed by the association of public health students in this faculty, for which she has been a very great pillar of support. She'll be missed by me because I think I've lost a very outstanding student and a potential PhD candidate. She'll be missed by this faculty where she studied and she came out with an excellent result. Abiola Olusola Obadare.